walked this floor and I shopped and I talked to people, and I ended up landing with wanting to use LightStim. One, because you had a lot of doctors that I knew that endorsed using your product that had a good experience, but you also had FDA clearance and you had some unique technology in your bed. So maybe can we talk about that a little bit so people can make educated buying decisions, even when it comes from either deciding which bed they're going to get in if they're going to a clinic or which handheld device they're going to buy?
It was a 6-year project to develop the bed. We worked back and forth with the FDA for 3 years. And the things that set our bed apart from anything else on the market is one, distance. So if you're further away than about an inch, there's just no possibility of you actually being able to penetrate that therapeutic light energy down into the muscles and joints and organs. You're just going to light up the skin. And so that was why we built a one-sided bed. We weren't trying to be different. We were just like, to get through the FDA, this is what we had to do. So we built a one-sided bed that you flip on halfway through the treatment, and the bed lets you know that it's time to do that and that sort of thing. And we made it so you're only a quarter inch off the tip of the LED bed, of the LED bulb, I'm sorry. And the next thing, or hurdle barrier that we ran into, was that we ordered our LEDs to be emitting light at about between 15 and 50 degrees, 45 or 50 degrees. And we knew that if we go wider than that, like maybe you go out to 75 degrees or 100 degrees, like LED loses its intensity too quickly and it completely loses its ability to penetrate. So we thought, like, okay, we're close. We've got the right LEDs. And so the next couple of test units that we built, like we started testing them, and we were getting no depth of penetration. And we narrowed it down to the acrylic. So the acrylic was taking our 15 to 45 degrees and it was dispersing it out to 180 degrees. It didn't matter. We were a quarter inch away. Nothing mattered. It was just killing the depth of penetration. So we spent 2 years working with the 4 largest manufacturers of acrylics in the world before we finally came up with this acrylic that lets the light through without dispersing it out to 180 degrees and lets about 99% of the energy through too, where we were seeing 20% drops before. And the third thing, and last, that really separates us is the FDA requires that you are able to raise the tissue temperature of the entire body to a certain level and then hold that temperature throughout the treatment time. And nobody had ever been able to pass this test before, because when you lay your body on a sheet or a layer of LEDs, what's going to happen is, if the engineering is correct, what's going to happen is your torso is going to heat up nicely. It has a lot of mass to it, and it's going to hold the heat too. So this is perfect. Problem is, your arms and legs that are a good 50% of your body don't have that mass. They actually won't come up to the same temperature, and they also are dissipating the heat as soon as you're feeding it to them. So this took us 3 years to solve, and in any picture of our bed on the internet or anywhere, if you see one in person, you'll see that it's not a sheet of LEDs, but there's actually 30 separate modules of LEDs. They're about 7 inches by 9 inches, and they might hold 600 LEDs or something like that. It's 18,000 LEDs in the whole bed. And if you look closely, in the center of each one of those modules is a little sensor that we've developed and utilized. And what the sensor does is, when you lay on our bed, you could put your arms and legs in any position that's comfortable for you. Everybody's different. You could move them during the treatment. It doesn't matter. But in about 3 seconds, that module is going to ascertain the exact temperature that one module needs to be, or that sensor is going to do that, actually, that the one module needs to be. And it's going to start raising the temperature of that module. Like, let's say it was for the arm, like the arm is touching that module, and it'll figure out how much mass it has and what the temperature needs to be for that one module. And then it coordinates in a computer program with the other 29 sensors, so that we're doing what the FDA says is the basics to start to get any benefits. There's more stuff beyond this, but you have to bring the tissue temperature of the entire body up to a certain level and then hold it throughout the treatment time. And we patented that. So I don't know of another way to pass that test and get FDA clearance without that. Our patents were pretty all encompassing. And
Yeah.
so then we got clearance and the FDA approved it for, like muscle and joint pain, arthritic pain, stiffness.